founding father of modern medicine was the Greek physician named Hippocrates. There is hardly any area of clinical or preventative medicine and basic personality or developmental psychology that is unmarked by Hippocrates. Hippocrates paved the way for physicians of his time and for modern doctors, for he was the first physician to come up with a plan of examination. Not only did Hippocrates' work transcend into the modern era of medicine, but his beliefs had a huge impact at the way he examined and diagnosed the human body. Before Hippocrates' time, there was no clear step-by-step process on how to figure out what was wrong with a patient. However, that changed, for Hippocrates was the first physician to develop a plan of examination, determination of the diagnosis, prediction of the disease progress, outcome, and treatment. Hippocrates stated that the entire step-by-step process begins at the bedside, with gathering information about the patient and the illness, and the approach to the patient was especially important. This practice transcended into the modern era, for even in today's world, it is important for doctors to have good bedside manner. It helps the doctors better obtain the information that they need to help diagnose the patient. Hippocrates emphasized that inspection, palpation, succession, percussion, and auscultation are the basis of every physical examination, and they still are even to this day. During Hippocrates' time, it was implied that nothing took place without the intervention of the divine. Hippocrates believed that everything is divine and everything is human, everything is one and one is everything is similar and everything is different. He believed that the same principles governed organisms and cosmos. As a physician, Hippocrates managed to not look for the cause of illness on a whim or in a capriciousness of the gods, but strictly in natural causes. Hippocrates believed that organisms naturally strive to establish balance and heal. Hippocrates believed that the body consisted of 4 essential fluids: blood, phlegm, yellow bile, and black bile. If one of these fluids was more dominant than the others, it would determine the constitution of the organism. For example, if yellow bile was the more dominant fluid, then it would mean the person's feelings are strong and easily expressed. On the other hand, if blood was the more dominant fluid, then the person was generally cheerful and optimistic. More importantly, if there was an imbalance among the 4 essential fluids, it could manifest into a disease. There isn't any area in medicine or psychology in which Hippocrates did not leave his mark on. Hippocrates laid the foundation for what we call holistic medicine and was the founder of anamnesis and physical examination. In today's world of modern medicine, doctors use the procedures and concepts that were introduced by Hippocrates, and even though his work originated 2.5 millennia ago, they are still relevant in our time because humans have remained the same.